Bipolar disorder is a complex mental health condition that can have both genetic and environmental factors contributing to its development. While having a family history of bipolar disorder does increase the risk of developing the condition, it does not guarantee that an individual will develop it. Preventing bipolar disorder entirely, especially in individuals with a genetic predisposition, is challenging. However, there are steps that can be taken to reduce the risk or mitigate the impact of the disorder. Early intervention. Recognizing the early signs and symptoms of bipolar disorder and seeking appropriate medical help can lead to early intervention and treatment. Early intervention may help in managing symptoms and reducing the severity of episodes. Medication and therapy. Treatment with mood-stabilizing medications, such as lithium or certain anticonvulsant drugs, can help manage the symptoms of bipolar disorder. Additionally, psychotherapy, such as cognitive behavioral therapy (CBT), or interpersonal and social rhythm therapy (IPSRT), can be beneficial in developing coping strategies and managing the condition. Healthy lifestyle. Maintaining a healthy lifestyle can contribute to overall well-being and potentially reduce the risk of developing bipolar disorder symptoms. This includes regular exercise, adequate sleep, a balanced diet, stress management, and avoiding substance abuse. Avoiding triggers. Identifying and avoiding potential triggers that can lead to mood swings or episodes can be helpful. This may include managing stress levels, maintaining stable daily routines, and minimizing disruptions or excessive stimulation. Support network. Building a strong support network, including family, friends, and healthcare professionals, can provide emotional support, understanding, and assistance in managing bipolar disorder. While these strategies may help individuals manage bipolar disorder or reduce the risk of developing severe symptoms, they do not guarantee complete prevention. Genetic factors play a significant role in bipolar disorder, and it is important to consult with mental health professionals for personalized advice and treatment options based on individual circumstances.